Welcome to the Global Dental Media Podcast, where today we're exploring clear aligners without a dentist and what you need to know.
We all love convenience, don't we? I mean, it makes life easier.
Absolutely.
And when you're talking about something big, like straightening your teeth, the idea of doing it affordably or right from your couch, oh, it sounds amazing.
Super appealing, yeah.
So today, we're diving into these direct-to-consumer or DTC clear aligners. You've given us this whole stack of sources on them. And our mission here is really to unpack it, all the risks, what's really going on, and maybe some safer ways to go about it.
Exactly. We need to look hard at what these companies claim versus the actual clinical side of things.
It's really at stake. Right.
Precisely.
Yeah.
Especially when you take the professionals out of the equation for something as complex as moving teeth.
Okay, so let's start right there. The big draw. Convenience, lower cost. They seem to promise you can just skip the dentist or orthodontist visits.
That's the main pitch, yeah.
Sounds good, maybe too good. But looking at these sources, what exactly are you skipping? Is it just sitting in a waiting room, or is it something more?
Oh, it's much more fundamental. And honestly, pretty dangerous.
Dangerous how?
Well, the sources are really clear. You skip the comprehensive clinical exam completely. Meaning no proper checkup, no x-rays, those panoramic ones that show your whole jaw, or the specialized ones.
Cephalometric.
Yeah, those. Yeah. They show hidden stuff, cysts, maybe tumors, the health of your tooth roots, how dense your bone is.
Stuff you absolutely need to know before you start pushing teeth around.
Critically important stuff, yes.
Oh.
And crucially, there's no professional diagnosis of underlying problems. Active gum disease, cavities, TMJ issues, bone loss. None of that gets checked.
So you could be starting treatment on unhealthy ground.
Exactly. Moving teeth isn't just cosmetic. It's applying force to living bone. That needs real biological understanding, clinical judgment. So something an algorithm or a gooey impression kit you do at home just can't provide.
The sources call it a dangerous omission. That sounds serious.
It is. It's not just cutting a corner. It's removing the foundation of safe treatment.
Okay, but I can hear someone thinking, look, my teeth aren't that crooked. Do I really need all that fancy stuff just for a little straightening? What do the sources say to that?
They say yes, absolutely, unequivocally. It's like building a house without checking the foundation.
It might look okay for a bit.
Superficially, maybe.
Right.
But the health of your teeth, your jaw, your bite, that could be getting seriously messed up underneath. And, that ties into how these companies operate legally, too.
Right, because this is where it gets kind of murky, doesn't it? Many of them talk about being FDA cleared. That sounds official. Safe, even. People trust the FDA. But is that the whole story the sources tell?
Not quite. There's a really key distinction there. So FDA clearance, usually the 510K pathway for these. Class 2 devices, moderate risk.
Okay.
All that means is the aligners themselves, the plastic tray.
The physical product.
Yes, are substantially equivalent to other aligners already on the market, like the ones professionals use. Yeah. Think of it like the FDA clears a scalpel as being sterile and sharp, but that doesn't mean you're cleared to perform surgery with it in your bathroom.
Gotcha. It approves the tool, not the person using it or the way it's being used.
Exactly. The clearance explicitly does not evaluate the safety or the effectiveness of the treatment model, the whole direct-to-consumer, no dentist visit approach.
Wow, that's a huge difference. So the FDA stamp is on the plastic, not the plan.
Pretty much. And then there's this other angle the sources bring up, this sort of legal sidestep.
How they get around actually practicing dentistry.
Precisely. Because in most places, figuring out what's wrong with a bite, planning the treatment, actually moving the teeth, that is the practice of dentistry, it's regulated.
Needs a license.
Needs a license, oversight, accountability. DTC companies try to skirt this. They argue the patient is sort of self-diagnosing with photos or impressions.
Wait, the patient diagnoses themselves?
That's the claim. And the company just facilitates getting the aligners made and sent. It's a legal argument, a loophole. It's definitely not a clinical standard for taking care of patients.
Which leads to the accountability problem.
Big time. If something goes wrong, who do you turn to? A remote company, maybe based somewhere else entirely. It's not like walking into your local orthodontist's office. The recourse is limited, often non-existent.
Okay, so we've got the missing diagnostics, the regulatory nuances, the legal workarounds. But what actually happens when things go wrong? This is where the sources get really concerning. The risks seem significant, maybe permanent.
Yes, often irreversible. And the sources lay out these risks very clearly. First up, undiagnosed problems.
Like the ones you mentioned earlier.
Exactly. Imagine you have gum disease, maybe you don't even know it, and you start moving those teeth. That can actually speed up bone loss. You could lose teeth.
Just from the aligners.
From moving teeth in an unhealthy environment, yes.
Yeah.
Or moving teeth that have underlying cavities or even abscesses. You're not fixing the alignment, you're potentially spreading infection.
That's awful.
And in rare but devastating cases, missing things like tumors or cysts on those x-rays they skip, well, that can delay critical, potentially life-saving treatment.
Okay, that's terrifying. What else?
Then there's the biomechanical damage. Your teeth aren't just sitting there, they have roots and bone.
Right.
Applying the wrong amount of force, or force in the wrong direction, can cause real damage. A big one is root resorption.
Meaning the roots get shorter?
Permanently shorter, yes. Weakens the tooth. This is something orthodontists monitor carefully with x-rays during treatment. DTC doesn't do that.
No x-rays, no monitoring.
None. You can also get significant bone loss around the teeth if they're moved too aggressively without checking the bone support first. Gums recede, teeth get unstable.
Loose teeth.
Potentially, yes. And though it's rare, really bad force errors could even damage the blood supply to a tooth, causing it to die. I mean, I've sadly seen patients come in after trying DTC. The convenience turned into a nightmare needing complex, expensive fixes.
Penny wise, pound foolish, as they say.
Definitely. And that leads right into bite problems. Occlusal disasters, we call them.
Occlusal means the bite.
How your top and bottom teeth meet, yes. Without a professional planning, the whole picture, not just the front teeth, it's very common to create new bite problems.
Like what?
Things like an open bite, where your front teeth don't meet, or a cross bite, or teeth hitting in ways that cause trauma or pain.
Which can cause jaw pain too, right? TMJ.
Absolutely. A bad bite is a major trigger for TMJ disorders, that painful jaw joint dysfunction. And think about it, if your bite is off, chewing can become difficult, even speech can be affected.
Wow. So it's not just about a pretty smile, it's fundamental function.
Totally. Plus, there are other common issues. Tracking failures, the teeth just don't move like the computer simulation predicted.
Happens even with pros, right? But they adjust.
Exactly. Professionals monitor and make adjustments during treatment. With DTC, you might get refinements, more aligners, but still without that hands-on diagnostic input, so results are often poor. Then there's oral hygiene nightmares. Aligners trap things against your teeth. If teeth are moving into weird positions, it's harder to clean, and the risk of cavities and gum inflammation goes way up without regular professional cleanings and checks.
Ugh.
And maybe one of the saddest things is delaying care for serious issues. A patient feels pain, thinks, oh, it's just the aligner's working, it's normal.
But it's not normal.
It could be a sign of a real problem, an infection, root damage, but they put off seeing someone because they think it's part of the process, delaying vital care.
This is a lot. It really paints a picture of why professional oversight is so critical.
It really is. If you connect all these risks back, you see that professional oversight isn't just like a nice add-on, it's foundational.
So what does that professional bring that DTC just can't?
Okay, several key things. First, as we said, the comprehensive diagnosis. That means the hands-on exam, talking through your medical and dental history, and getting all the necessary records, x-rays, scans, photos, seeing the whole picture.
The stuff DTC skips.
The vital stuff, yes. Then individualized treatment planning. This isn't just make teeth straight. It's about your facial aesthetics, how your jaws relate, maybe even your airway, long-term stability, your actual goals. An algorithm can't weigh all that.
It's more holistic.
Much more. Then there's ongoing biological monitoring, using those periodic x-rays and checks to spot things like root resorption or bone loss early when something can potentially be done.
Catching problems before they get severe.
Exactly. Professionals also bring biomechanical expertise, knowing how much force to apply, where to apply it, using attachments on teeth for tricky movements, adjusting the plan based on how your teeth are actually responding week by week.
Adapting the plan in real time.
Yes. And crucially, they're there for managing complications. If you have pain, if an aligner breaks, if something isn't tracking, or if there's a real emergency, you have someone to call, someone to see immediately.
That peace of mind alone seems valuable.
Immensely. And finally, long-term stability planning. Getting teeth straight is only half the battle. Keeping them there requires retainers and follow-up, tailored to your specific case.
Okay, it really does highlight the difference. But let's be real, cost and convenience are big factors for people.
Of course they are.
So, if someone hears all this, understands the risks, but is still interested in clear aligners, maybe they just want a more affordable or accessible path. What are the responsible options? How can you do this safely?
That's a great question, and the sources point to several safer routes. The absolute best first step: consult an actual orthodontist.
Even if you think you can't afford it.
Especially then. Many offer free initial consultations. Go, get a proper diagnosis, understand what your specific needs are, discuss all the options. Maybe traditional braces are actually better or faster for you, maybe professional aligners like Invisalign or Sparky, and talk about payment plans. Most offices are willing to work with patients.
So get the expert opinion first, regardless.
Yes. Another fantastic option, especially for cost savings, is looking into dental school clinics.
University programs.
Exactly. Orthodontic departments at universities offer high-quality care. It's done by residents, but they're rigorously supervised by experienced specialist faculty. The costs are significantly lower.
That's a great tip. What else?
Ask dental offices about discount dental plans they might accept or offer, or about in-office financing. Lots of practices have membership plans or flexible payment options, sometimes interest-free for a period. You really have to weigh the upfront cost of professional care against the potentially huge cost of fixing DTC problems later.
Makes sense. What about professional aligner systems?
Right. Systems like Invisalign, Sparky, and others, these are professional clear aligner programs. The key difference is they require in-person supervision by a trained dentist or orthodontist.
So you get the aligner tech, but with the safety net.
Precisely. You get the comprehensive diagnosis, the potential for attachments to make complex movements possible, and that crucial professional monitoring throughout. It combines some convenience with essential oversight.
Okay. And one last point.
Yes. If money is the primary barrier right now, sometimes the best choice is to focus on essential dental care first.
Meaning,
see your general dentist.
Okay.
Get any active cavities filled, treat any gum disease, get your mouth healthy first. Crooked teeth, unless they're causing immediate functional problems, can often wait until you can afford safe, professionally supervised treatment. Health first, alignment second.
That's really practical advice. So to help people steer clear of the risky options, what are those big red flags in the marketing for DTC aligners? What should make someone pause?
The sources list quite a few. A huge one is seeing "no dentist visits needed," shouted like it's purely a good thing.
When we know it's actually a danger sign.
Exactly. Or free impression kit. That sounds tempting, but remember, a real diagnosis means way more than just that goo.
Okay.
Be wary of cost comparisons like 60% cheaper than braces. They usually compare to the most expensive type of full traditional ortho and completely ignore the risks and the potential cost of fixing things if they go wrong.
Cherry-picking the comparison.
Right. Also, phrases like clinically proven results. That often just refers to the plastic the aligner is made from, not the remote treatment method itself.
Tricky wording.
Very. And relying only on maybe a few photos you upload for a smile assessment or just those self-taken impressions. That's not enough data for safe treatment planning.
Not comprehensive.
Not at all. And finally, if it's vague about who's actually overseeing your treatment, sometimes it's dentists in another country with very limited direct involvement. That's a major red flag regarding accountability and expertise.
So transparency is key. Who is actually responsible for my treatment?
Absolutely. Ultimately, the sources really converge on one point. The ethical and professional consensus is a strong recommendation against any clear aligner treatment that doesn't involve direct, ongoing supervision by a licensed dentist or orthodontist you see in person.
The risks just outweigh the benefit.
Massively. We're talking about healthcare, your teeth, your bite, your jaw health. It's not just buying a product online, it's undergoing a complex medical procedure.
So wrapping this up, the core message from all these sources seems clear. Clear aligners without dentist approval, while tempting, essentially bypasses critical healthcare safeguards. And the potential fallout, we're talking root damage, serious bite issues, losing teeth, missing dangerous underlying conditions can be severe, costly, and often permanent.
That's the reality.
So the advice is really to explore those responsible alternatives we talked about, the ones that keep a qualified professional in the loop.
Definitely. And maybe it leaves you with a final thought to chew on.
I go for it.
What is the true cost of convenience when we're talking about something as fundamental as your health? Is it really a saving if you're gambling with irreversible damage? Your long-term oral health, your ability to eat comfortably, to smile confidently, that's worth the investment in proper professional care.
Thanks for joining us on the Global Dental Media Podcast. Stay informed, keep smiling, and we'll see you in the next episode.